Hello family, I'm so glad to have you back. Welcome to another informative video where we'll be talking about another type of contraceptive that can be used by the ladies or can be recommended by the gentlemen to their partners. So today we're talking about an implant. So it is basically a device that is implanted on subdermally, which is just beneath your skin, be it on the left or on the right inner part of your arm, right? So it depends on whether you're left-handed or right-handed. So if you're right-handed like me, then it's implanted on your left inner part of the arm, just right here. So mine is just right here. Or if you are left-handed, then it will be implanted on the right hand side on the inner part of your arm. Okay, so what does the implant look like? So one which we have in the market in South Africa for now is the Implanon. So this one, it looks like this, and it is available for purchase at private institutions. It goes from 1,000 Rand and above, and also it needs a prescription because it is a Schedule 4 item, so it needs a prescription from the doctor. But you can get it for free at public institutions, and it can only be inserted by a trained healthcare professional, be it a doctor or a nurse. Okay, so it looks like this. It is actually not this big. It is a plastic rod which is the size of a matchstick. So if you know the size of a matchstick, so that's basically how big it is. And this one is basically, you need to make sure when you're getting it from the institution you're getting it from, that all the packaging is still properly sealed, so that you don't use one that is not going to be effective for you for use. Right, so how then does the Implanon prevent birth, right? So it basically has a hormone called etonogetrel. So the etonogetrel is classified under the hormones called progesterone, right? So the progesterone, how it works, it inhibits ovulation in the female body, and therefore also changes the cervical mucus, so the sperm won't be able to move freely and fertilize the egg, right? So what I like about the implant is that it is so suitable for most females to use. It is 99% effective in preventing pregnancy, and I also love the fact that it can be implanted on any individual with immediately, if you've just had an abortion or if you've just had a miscarriage and you're looking for a way to actually prevent pregnancy from occurring. It can be used or implanted immediately. The other thing is that it is easy to remove, just as how it is easy to insert. Okay, so as long as it is inserted by a trained healthcare professional, it is very simple. Removal as well is a tiny surgical procedure. So they do a tiny incision on where it is and plug it out of your body. Definitely they will use an anesthetic to just numb the pain in that area, but they do a tiny incision. Also, the other important thing is that if you're one person who is very active, this one is the best for you to use because it doesn't interrupt sex, since it is just on the arm. And also, if you are using the Implanon and you are breastfeeding, it is perfectly fine for use during breastfeeding. You don't have to stress about lactation and it being transferred to the breast milk. Okay, and then also, if you're one person who is very forgetful, the pill is not for you, because the Implanon can be used and be effective for a period of 3 years. So if you're very forgetful and won't remember to take your pills every day to prevent pregnancy, Implanon is the best suitable way for you because it can be in place and effective for a period of 3-4 years. The other good thing is that should you maybe somehow be involved in any strenuous activity and then the Implanon gets bent over or moved a little bit, it actually still can release the etonogetrel into your body, so you don't have to worry about it not being effective at all. So if you are one of those that are worried about the Implanon, be it moving around or not being found around your arm for removal, you don't need to stress, because it can be actually traceable by ultrasound scan, or most of the time it is palpable, like mine. So it's basically very, very palpable, like you can feel it and you can see it. So you can request your nurse or the trained healthcare professional who's inserting it to either insert it deep or just make sure that it's palpable for you, especially for a smooth removal. Right, so we've spoken about the benefits. Everything has its pros and cons. So when it comes to the Implanon, the contraindications or things that you need to have caution is basically migraine. So if you're struggling with migraine, this is not for you. So you shouldn't be using it, because it's part of the side effect is headaches, and it also contains progesterone, which will exacerbate in migraines if you're struggling from them. Undiagnosed vaginal bleeding or vaginal infections, then it's not suitable for use for you. If you're struggling with either breast cancer or ovarian cyst, then you are not suitable for using this contraceptive. Venous or arterial thromboembolism also, so which is basically a condition whereby you are having clots, be it in your arteries or in your veins. So if you've had a case of that, then the chances of it recurring is very high. So it's better not to use this type of contraceptive. If you've had ectopic pregnancy prior, then we wouldn't suggest that you have this one. And also, if you're struggling from hypertension, so if you're one of those that you were already diagnosed and you're taking hypertension medication, this Implanon has been, there's been reports of it actually increasing the high blood pressure. So if you're already struggling with high blood pressure, then it's best you try another contraceptive. Caution should be exercised if you are a diabetic patient. Reason being is that the Implanon, it has an effect on peripheral insulin resistance and also glucose tolerance. So now what does that mean? That means basically if you're struggling with diabetes, then you take you are put on the Implanon as a form of contraceptive, you will have to be monitored for a period of 1 month. So the first month of you having the Implanon in your body, they will have to monitor you, so just to see if the glucose levels are still maintained. Okay. And then we have things such as side effects, right? So the side effects of this is basically headaches, as I've mentioned, and acne, and also breast tenderness and pain. Also irregular menstruation. Remember, we said it inhibits ovulation, so it doesn't suppress it completely. Hence, you will be spotting every now and then, and your menstruation won't be as regular as it would if you were not using this contraceptive. And then also, it has a tendency of increasing weight, and to some patients actually the weight decreases, so it varies per individual. So in other people, then you might gain weight, in others you might maintain or even lose at some point. It also, the other common side effects that you need to look out for is that, unfortunately, if you're one of those who really love engaging your partner, it decreases the libido. So you would have to find other hormonal therapies to just increase your libido. So it decreases your libido. And also, if you are depressed already or on antidepressants, I wouldn't really advise much for you to take the Implanon, to be using the Implanon, because now it's one of its side effects, which are very common, is a depressed mood. So you might actually be affected in that way. It increases your appetite, hence the weight gain. It also causes ovarian cysts and abdominal pain, and also dysmenorrhea, so which is your irregular menstruation, and also at some point the menstruation might be painful. And in other instances, you might actually have amenorrhea, which is not seeing your periods for a long period of time. All right. And then also, if you're struggling from conditions such as liver disease, or you've had a stroke or a heart disease, this contraceptive method is not for you at all. However, through all in all, this I would really advise it for all females out there to just go for it. It is the best contraceptive to use. I would vouch for it any day, anytime, because it also has, it basically is a 68 milligrams, right? So there's the 68 milligrams of the hormone in it, and it releases the hormone in your body slowly. So it releases about 60 to 70 micrograms, per day, from week 5 to 6. And then it goes down to 35 to 45 micrograms in the first year, and then 30 to 40 microgram in the second year, and then 25 to 30 micrograms in the third year, which is why then eventually you won't have much in your body and you have to change it in the third year. So if you're one of those who are struggling with weight and you are obese, then the problem is that the plasma levels of etonogetrel, they're inversely proportional to weight. So you would have to then be monitored for the first few months of using this type of contraceptive. So let's say you are taking other medication. Now you're like, Nomsi, what do I do? Because I am HIV positive, or I am I've got TB, or I have epilepsy. So there are certain conditions which their medication will influence the efficacy of the Implanon. So if you're HIV positive, the efavirenz found in your antiretroviral medicine, the lopinavir, the ritonavir, which is found in it, will basically decrease the efficacy of the Implanon over time. So I wouldn't really suggest that you go for this type of contraceptive. If you have TB, luckily TB is a 6 months medication. It's not, you don't take it for lifelong, right? So you would basically have, if you insist on being on this type of contraceptive, then you would have to be monitored over a period of time, and you would have to use other contraceptive methods for the time being together with the Implanon. For an example, you might have to use a condom whilst you know that you already have the Implanon, just to make sure that you are protected against pregnancy, right? So the TB medication also negatively affects the Implanon. If you're struggling from epilepsy, or if you're struggling with conditions such as nerve pain, like extreme nerve pain or muscle pain, and you are put on carbamazepine, which is known as Tegretol. So if you're taking carbamazepine, phenytoin, it negatively impacts the Implanon efficacy, so to a point where it actually might be reduced and pregnancy might occur as a result of that. Okay, so if you also using herbal medicines, right? So I know a lot of times you guys don't confide in us, when we ask you, are you taking any medication? So herbal medicines, it will actually decrease the efficacy of the Implanon over a period of time. Otherwise, this is the best type of contraceptive to use, provided that you are the suitable candidate for using it after the nurse or trained healthcare professional has assessed and has taken any test and did confirm that you are the suitable person for using this contraceptive. It's very much effective. Thank you guys so much for watching. Don't forget to like, don't forget to subscribe, don't forget to share. You're more than welcome to ask any questions. Leave any questions you might have about this contraceptive beneath the video. Thank you so much. See you on the next one.